We have multiple videos comparing supplement plans and their coverages, and in this one we are going to go over the strengths and weaknesses of the high deductible Plan G supplement plan option. So let's get into it. High deductible Plan G is becoming quite popular in various parts of the country for several reasons that we'll mention in this video. If you haven't seen our other videos, we break down the 6 significant hospital and medical gaps that original Medicare does not cover in more detail, and in this one it'll just be a quick synopsis. There are 6 gaps and their costs: the Part A deductible, the Part A hospital copays, the Part A skilled nursing copays, the Part B deductible, the Part B coinsurance, and the Part B excess charges. For more details on each of these, this video right up here has it all for you, and you'll need to be aware of these gaps to understand each plan's strengths and weaknesses. So why is high deductible Plan G popular right now? Well, it has 3 main strengths. The first is its lower monthly premium. A regular Plan G in our area averages about $150 per person per month for a 65-year-old. A Plan N is about $120 a month. A high deductible Plan G averages $56 per person per month, almost $100 in savings per month compared to a regular Plan G. This is very attractive to a lot of people who don't like paying for something that they don't use, but would like to have something in case something bad does happen. The second strength of high deductible Plan G is that once you meet your deductible, you're done. Original Medicare and your supplement plan will cover 100% of your Medicare-approved services and procedures after you meet your deductible, including the 6 gaps of original Medicare that were shown here. High deductible Plan G will cover your Part A gaps of the deductible, the hospital copays, the skilled nursing facility copays, as well as your Part B gaps of the deductible, coinsurance, and excess charges. All good things. Finally, the third strength lies in the freedom all supplement plans bring in terms of access to all providers who participate with Medicare anywhere in the country. I do need to mention that not all providers participate with Medicare, but when it comes to your high deductible Plan G, you are covered for an estimated 99% of all providers nationwide. Not bad at all. High deductible Plan G really has 3 weaknesses that we see, and the first has to do with that pesky high deductible. The deductible in 2023 is $2,700. That is a big chunk of change. Plan G kind of straddles that, should I get an Advantage plan or should I get this high deductible Plan G line? In general, the big draws to supplement plans are the low cost sharing once you do need to use the healthcare system, and the freedom to make healthcare decisions with the access to doctors and much lower risks of denials. Well, high deductible Plan G doesn't really have a huge advantage in the cost sharing categories, and in certain areas becomes much more expensive from both a premium perspective and a cost sharing perspective than Advantage plans, making it a harder choice for people. It still has the access to providers, and it pays secondary to Medicare, which means if Medicare covers it, high deductible Plan G will cover it, but that deductible is hard for some people to ignore. The next weakness is the same with all supplement plans, but to a lesser degree with high deductible Plan G, and that would be premium increases. Supplement plan premiums increase over time, and with many plans, it can be 2 increases per year, one based on rising healthcare costs and inflation, the other based on your age. So high deductible Plan G premiums will rise with time, and there are community rated plans out there that are not based on the age, but they do still have the increases that happen once a year. Finally, the last weakness to not just high deductible Plan G, but all supplement plans is the fact that they only cover those Part A and Part B gaps that we mentioned earlier. Supplement plans do not cover things like Part D prescription drug coverage, dental, vision, hearing aids, or long-term care. You would need to purchase those all separately with their own monthly premiums, their own deductibles, their own copays, and coinsurance amounts on top of what you're already paying for your supplement plan coverage. Candidly, we don't have a lot of carriers specifically where I live that offer high deductible Plan G. There are some in other areas and states that surround us, but not specifically here. But that doesn't mean that they're not a great option for a lot of people in other areas with more access to carriers who offer these plans. Now, you'd better believe that we'd have other videos about regular Plan G and Plan N with their strengths and weaknesses, so watch for those. If you found this video helpful, it helps us a lot if you're willing to give this video a like and follow our channel by subscribing. If you're feeling super generous today, I'd really appreciate it. Thank you for spending some time with me. As always, I appreciate you, and thank you for watching.